Keith, it's a question for you. I'm kind of a muscle person, but I love tendon too.
Muscle is just tendon with a little bit of tissue in the middle.
Yeah, I know. My question is, why does the injury occur in that area? What is it about the mechanics or the biology that results in that consistent injury pattern?
As far as say the patellar tendon jumper's knee.
Yes.
So that's where the stress or strain concentrations are the highest. And so because of the architecture of the patella, it's coming really narrow really quickly. And so you get really more extreme stress or strain concentrations at that point. And it becomes a secondary issue because you get the compressive force when there are small bits of injury. So one of the things that we think inflammation does is it actually decreases the tendon's stiffness a little bit. And one of the reasons, as Professor Blau said, one of the reasons we want that inflammation is because it actually decreases the stiffness of the healthy part, so I can get load through the injured part. And if we do all these things to stop it, then we're going to not ever regenerate it. So the reason that jumper's knee is happening there in the long term is probably because of that stress or strain concentration. When you have acute jumper's knee, it's actually lower, and it's probably more because of the inflammatory response in the fat pad that's right underneath it, because that's where you're getting most of the vasculature, and that's where you're getting most of the inflammatory signals.
Thanks, Keith.
Rocky?
Rocky Tuan from Hong Kong. So since Bob was asking which tissue is the most important one in the musculoskeletal system, so I'm just curious, Helen, since the gerozyme, the PGDH, appears to be so important, so would it be possible for the Alliance folks to get together and look at your overexpressed mouse, for example, and see if the other tissues are also affected in terms if they're injured? That includes tendon, that includes cartilage, bone, and muscle. Would that be a doable thing for everyone?
I think it's a great idea.
Maybe an advisory board member should suggest that.
So one of the key things there is the tissue crosstalk idea. And there you need what Bob had talked about, which is really good in vitro models of each system that does mechanical, that you can do, because these are mechanical tissues, you have to be able to test them mechanically. And so we can do that with tendon. I know that Bob's got some with bone, and I know that some people have that with cartilage as well, where you can take, say, the serum coming out of those animals and put it into this engineered tissue and say, does what's happening in muscle affect what's happening in tendon, in bone, and all of these other tissues? That's where having those in vitro mechanically testable models is absolutely essential.
Mary, I think you were
Mary
next.
Buckstein. Also for Dr. Blau, really fascinating work. Question is, what about cardiac muscle and smooth muscle? Does the same mechanism play a role, and is there a role for this?
Yeah, thank you. We just got a grant to look at lots of tissues, and we're very actively pursuing that. We want to know to what extent is it rejuvenating other tissues.
Could ask all of you a question. Thank you all so much. Dr. Blau, this is for you. I wonder if you could clarify, I believe I remember from your slide that you said administering the gerozyme returns the aged mouse to its youthful function. So I'm wondering if you were to give it to a young mouse, can you get it to overexpress? And I'm thinking about how many times I got a knock on the door to pee in a cup. Is this something that could be doped with, assuming that you could put it into a human model, or is it just going to get you to normal for longer?
Okay, so the gerozyme is not a good thing. It's a aging enzyme, and it increases with aging. What we're doing is using a small molecule inhibitor to inhibit its activity. And what we found is that even in young mice that don't have all that much enzyme, you can increase their strength somewhat. You have a more dramatic effect in the aged, where there's more of the enzyme and more weakness. Young are doing so well that you just modulate it up a bit.
Up from normal, though?
Yeah.
Okay.
Do you see any change in pain sensitivity in those animals?
In pain sensitivity, we haven't looked at that yet. Yeah. But it will be interesting.
Great.
Well, I just want to say thanks for a great session so far. I, again, would have questions for everyone, but want to just harp on some points that Keith brought up about the stress relaxation. And I was wondering if you've done any of the spatial transcriptomics work on muscle that you've done stress relaxation training.
So we've got spatial data from time course after injury, so that we can look at the injury, and we've got spatial data time course after isometric contractions. So we've got that. I've already talked to Ewan about getting some help with some of the, because the file size is massive, and just getting good readings from it is going to be key. So, again, that's one of the things I was coming here to.
So as a follow-up then, do you see those tenocytes that are then migrating into the injury site? And if so, what's the molecular mechanism that they seem to be using to sense the sort of mechanical gradient that they need to then migrate? We see a lot of things in cancer saying going in sort of opposite directions of what one might assume, sort of like anti-durotactic behaviors. I was wondering if you're seeing any sort of like durotactic behaviors.
Yeah, so again, Michael Milantowski, who's also on some of our Tsai stuff, he's shown that the peritenon cells are actually have a stem cell like behavior, and they will migrate in. And one of the interesting things, again, with cancer is as you look at it, one of the odd things that comes up is lysyl oxidase is overexpressed in a lot of things that are metastatic. That means that, and it's kind of counterintuitive, if you make the matrix stiffer, somehow the cells are able to migrate better. And so it's possible that what we're getting is something like that, where we're getting a signal that's coming from the middle, we're getting a stiff area because that's actually getting more load, and now it's actually helping those stem cells come in. We haven't had a chance yet to look at that, but it's a great question.
Thanks.
If I could ask Kaylee a question. Where do you think, in terms of sports injuries, your sensorized suture buttons may have early applications?
For the suture button, the biggest application we're looking at right now is ACL repair. But anywhere that uses a suture button could potentially be interesting.
Thank you. Another question here.
Hi, Damian Callahan, University of Oregon. These were all great talks, especially Nick Bullock's. Top notch. But my question is for Dr. Blau, that was outstanding. Translating these studies from mice to humans, age-related atrophy in humans comes largely from remodeling of the neuromuscular system, where we have loss of high-threshold alpha motor neurons and loss of cell number in addition to cellular atrophy. Do you expect crosstalk between the muscles and the alpha motor neuron pool, or would that be a potential loss of efficacy for this treatment?
No, we hope that that's a mechanism by which it works. I think you're right that you very much need neuromuscular crosstalk. Something we're actively looking at.
Maybe I'll ask the last question. Keith, I noticed on one of your slides you were showing the protein turnover in the different tissues, and the one that really stood out was synovium.
Yep.
Was super high.
Absolutely.
Can you give any thoughts on the importance of that?
So again, these are those studies, super hard studies to do. They're getting people getting total knee replacements. They're doing infusions of stable isotopes. They're measuring the rate of incorporation of those stable isotopes. The synovium is turning over super quickly. A lot of that's also going to be nutrient supply to the tissue, so it's going to be closer to the nutrient supply. It's going to probably have a greater degree of stem cell within it, and so you have probably higher turnover rates within that synovial tissue. And so I don't know whether that's going to be a source of endogenous stem cells for things within the knee, but that possibility is definitely a really interesting one.
Fantastic. All right, we're right at time, so let's thank all of our speakers again for this.